I'll just, before I go to my videos, I'll just give a brief description of what is chopping, which it is a manual separation of the fragments of the nucleus, and that reduces our FECO time. And advantages are reduction in FECO energy, reduction on stress of the zonules, as has already been described, and ability to perform supracapsular FECO emulsification. If it is in a small pieces, chances of the PC rent will be less. And basic difference between horizontal and vertical chop is that in horizontal chop, we are doing in a more or less a blind procedure. We go till the equator. In vertical chop, it is visible. So let us, since time is less, I'll go directly to my videos. And since the topic is vertical chop, I have shown various grades of nucleus, and to start with just a normal NS2 grade. And what you can see in vertical chop is visible just near the FECO tip. You disengage and break the nucleus into the small pieces. It can be done in two ways. Here, what you are seeing is that the nucleus is being chopped, and then the segment removal is being done simultaneously. Alternately, what we can do is that we can divide it into multiple small pieces and then finally do segment removal. Both are fine, but it all depends on the choice of the surgeon. And you have to be very careful always while doing the segment removal, be in the center. And as you can see, the FECO energy used will be very less if you do it properly. And in this case, it is just CD of 2. Now coming to a slightly harder nucleus, which will be around NS3. And again, compared to a softer, this will be easier to chop because you get a better grip of the nucleus. And always during chopping, we should be careful that we don't break the occlusion. So the chopper or dialer, in my case, I mostly use the Sinskey hook, and it should be just lateral to the edge of the FECO tip, so that while breaking it into small pieces, the occlusion doesn't break. And what you see here is again, same procedure I'm doing is that doing the segment removal simultaneously along with the chopping. And as in slightly harder, you get a CD of 10.5. Now comes the real issues, what we are discussing in this session, which is a total cataract. And what here you see, we are measuring the rhexis size using Varian, and the size is 5.5. The actual rhexis is maybe less than 4 millimeter. So it is always better to make a relaxing cut, because unnecessarily in a hard nucleus will cause stress on zonules and end up with complications. So we should not worry about 5.5. Even slightly larger than that is acceptable, but the comfort of chopping has to be there with an adequate size rhexis. And in this, the viscoelastic can be a dispersive viscoelastic if we are using forceps. And as you can see here, we are making a big crater in between because of the hardness of the cataract, and then start chopping. And most important in this is breaking the posterior plate of the hard nucleus. So here you see that my technique has changed. Now I'm chopping mainly and not doing the segment removal simultaneously. And that is more practical in case of harder nuclear. And if you could notice, the video is absolutely unedited, just the speed has increased, and with very small pieces are being chopped. And once you are comfortable, bring it in the center and do the segment removal. And always we have to break its connection with the posterior plate. That is the key in this case. And as you can see, half of the nucleus has been moved out of the bag because posterior plate is still intact. And to reduce FECO energy, we have to cut the posterior plate and then remove that segment. Again, this was possible because of the larger size rhexis. In a small size rhexis, this will not be possible when we are dealing with hard brunescent cataracts. And with every piece, as you can notice, the first point is the posterior plate. And now the real brunescent cataract, again, you see a adequate size rhexis and then making a large, big crater in the center and make it as deep as possible. So this is the key, because this is mainly debulking the nucleus, and then you start the vertical chop once you have debulked it properly, and then start the vertical chop in these nucleus. Try to reach as close to the posterior plate as possible. And since the phaco energy will be much more higher in these cases, so frequent use of viscoelastics, and preferably a dispersive viscoelastic to protect the endothelium, as Dr. N has already covered. And then start chopping every 1 to 2 clock hours. Again, what we use in normal normal NS2 or NS3, this will be totally different from that. Keep on chopping, keep on debulking, and the main mechanism remains the same. And in between you got a small pupil, so always visualization is the most important thing. So whenever you feel that your the pupil is not acceptable size, we should never hesitate to use iris hooks. And again, starting from the posterior plate, once the nucleus has been disengaged from the bag, cut the posterior plate first and then remove all the smaller pieces. So that is how we can achieve success in hard brunescent cataracts. And it's done. So, and again, the last variety, what I would present in my video is the small hypermature cataract with a small, it is a hard cataract only, but floating, because the peripheral cortical fibers have got absorbed and the nucleus is mainly mobile. So chopping in this becomes more difficult because we don't have the cushion of the epinucleus in these cases, and the nucleus, we don't get proper grip on the handpiece. And I tried to remove it, but that was not a good thing to do considering the size of the rhexis. So always try to chop it and multiple small pieces. And see, this is a classical vertical chop. And once we have achieved the chopping every 1 or 2 clock hours, and but again the problem is same, that the posterior plate is intact. So yes, just at the posterior connection of the posterior plate, you start chopping, start segment removal, and every small piece will come one by one. So total 5 varieties, and all of them having the vertical chop technique.